Hi, Bob here from Inform Health. In this video, you will learn about genetic testing for hereditary cancer, why you would want to do this test, and what you can expect from the test results. Understanding if you have an increased risk of cancer due to genetic history can help both you and members of your family to proactively manage these risks and help reduce the onset of cancer. Hold on a second. Before you say, I don't want to do the test, or I don't want to know, or I just want to enjoy my life. Hereditary cancer screening helps people with a strong personal or family history of cancer understand their own risk of developing cancer. With this information, you can take steps to potentially prevent cancer, delay the onset of cancer, or catch it at an early stage when outcomes and survival rates are better. Cancer is caused by many things. It is very complex and sporadic in many instances, with unknown causes. However, approximately 15% of cancer is caused by gene mutations that are passed down through your family. Inform Health provides a groundbreaking DNA-based review of your genes to determine the presence of any mutations that may present themselves as cancer in you or your family. This test looks for a myriad of mutations for signs of cancer, potentially including breast, melanoma, ovarian, pancreatic, prostate, uterine, colorectal, and stomach cancers. Plus, we provide a comprehensive test for cancer mutations depending on your personal and family history to provide a total view of your health. Our test is fast and simple. Your healthcare provider uses one of our sterile swabs, like this one, and takes a quick swab of the inside of your cheek to get a DNA sample. That's it. Results are typically provided back within 4 to 6 weeks. You and your healthcare provider can then use this information to set up and execute a preventive maintenance plan to minimize your chances of getting cancer. Plus, any mutations identified can signal the need for testing of other members of your family for signs of this potential cancer as well. You have a 50% chance of passing a gene mutation to your children. Knowledge is power. It is better to know and understand risks than operate in the dark. So how can this test help you? Detection of breast cancer early increases your 5-year survival rate from under 25% for late-stage detection to over 98% for early detection from test results like Inform Health's genetic hereditary cancer testing. Another example is that most men by the age of 70 have a 2% chance of getting colorectal cancer, while men testing positive for an identified mutation in the MLH1 gene results in over 40% chance of getting such cancer. So what can you learn from genetic testing? And what is not learned? A mutation found does not mean that you will get that cancer and is not a diagnosis for cancer. It is, however, a strong signal to proactively manage your health for such cancer. For example, a woman who tests positive for breast cancer with BRCA1 has an over 80% chance of getting breast cancer versus 10% for those that test negative. Even when no mutations are found, that does not mean that your risk is zero for such cancers, just a significantly lower risk than those that have gene mutations identified. Environment and lifestyle remain significant contributors to cancer. For example, smoking as a contributor to lung cancer. While genetic testing is very good, no genetic tests detect everything. Don't be afraid of the answer. Knowledge is power, and power eradicates fear. Knowledge helps you make all the right choices to minimize the onset of cancer, even if you test positive for DNA mutation. Your results are helpful for your relatives and children to educate them on their chances of developing cancer. You should share your results with them and encourage them to have the same Inform Health genetic hereditary cancer screening test done if appropriate. Your results are very unique to you, and such results may or may not be similar with your relatives. And as always, genetic counselors are available to discuss your results and answer any questions that you may have. Peace of mind for you, peace of mind for your family. You deserve to know. And hereditary genetic cancer screening using DNA is now covered by most insurance providers. Get in touch with us today for more information.